The main thing here is, as you had mentioned, that that the social medias have not been, have not been, how shall I say it, they are not regulating what they are putting on at all. With the net result that there has been all kind of conspiracy theories, there have been all kind of fake science that is being distributed. If you have any questions, I would say please talk to your doctor and try and get the information. Now, the problem has become that people have started mixing politics with prevention. Governor DeSantis has decided to distinguish himself, and I'm not just, this is all over the paper, so I'm not just talking through my hat, so to speak of, in which he has said very clearly that he is not going to subject his constituents, which means Florida state residents, to either masks or to vaccination. The younger population under the age of 65, he is basically going to support the decision not to mask and not to get the vaccination. This is the political reason for which he's doing it, because he wants to distinguish himself from President Trump, who at one level he also supports. I mean, he has said it very clearly that if he is the choice of the Republican Party, he will vote for him. But this is becoming like a distinguishing factor that he's working on,
Yes.
But I think that we all have to be cognizant of all of these issues, social media, vis-a-vis the fact that we are also so done with it. We keep hearing it, even comedians, and rather, I don't know what to call them, like somebody like Bill Maher, who says, I'm so done with it. I don't care. Everybody should go and get it, more or less. Except that there is long COVID. It is causing problems. At one time, when COVID first came, the population that suffered the most was the minorities, the Hispanics, the Blacks. Right now, and there were not too many people, say, for instance, in Massachusetts who were suffering from it. But this time around, we are seeing it in our elderly population. And the administration of institutions, including some of the SNFs, which is the skilled nursing care facilities, rehab facilities, are very reluctant and almost hesitant because of the political pressure to start emphasizing that it is time to take measures such as wearing the mask again. According to NPR, which was day before yesterday, they talked about how the Veterans Administration nursing home facilities in New Jersey, these are huge, and they had come under criticism previously also, are once again showing a higher incidence of death of the residents of these facilities with COVID, that is, than other institutions. And this has to do with, to a large extent, because of poor administration, not proper checks in who's coming in and going out, and of course, not wearing the mask,
So, Dr. tell us, how do you deal with your patients when they come in with all these ideas from Facebook or Twitter and other sources? I'm sure there are arguments when you tell them get a vaccination or get a mask, etc. How do you deal with that as a medical practitioner? That's so tough.
It has been a learning curve. I thought I knew how to practice medicine, but you keep learning new things, just like we had to learn about AIDS, and we had to learn about the swine flu, and then about the West Nile, and now we have learned about COVID, and it's always done, when you are running at full speed, and you have to learn all this too. So, I've always used the direct approach. And as I said, I have been in practice in the same place for a long time, and I thought I had good relationship with patients. But obviously, however good my relationships may have been with them, it is not equal to the social media, whoever they are.
Yeah.
They trust what they're seeing, some stranger tell them on social media. So the direct approach, I found out, was totally backfired. They do not want to hear that. You have to stand there. It's a consumption of time, and nod your head and kind of listen. In the beginning, and it's very interesting, because as I'm developing new methods of how to communicate with them, they're developing new methods on how to convince me that what I am saying is incorrect. Dr. Google, I can't even say it's Dr. Google. This is Dr. Social Media, conspiracy theory. I've had patients who live here in Larchmont go all the way into deep New Jersey, into horse country, to get treated by a veterinarian. I'm not making it up, because for a while, one of the theories that was being promoted was that this horse deworming medication is the one that you should take. Now, why would somebody who I've taken care of for 30 years want to cross the GW bridge, drive 70 miles off, go to a veterinarian and take a medication is beyond me. I mean, I think we have to do, you're into media, so you'll have to do some study as to and understand that your influence is far greater than a person who's sitting directly in front of a person physically.
Unfortunately, Dr. Hamiduddin, one of the problem has been these conspiracy theories that you mentioned. But one conspiracy theory that I have come across, in fact, I know a gentleman of Pakistani descent who keeps on sending these long emails to me, in which he says that the vaccine is actually a conspiracy by the government to
Yes.
trap us. So tell me, tell the viewers about that these vaccines are safe.
So when the vaccines came out, the saddest thing is that we have lost people that I knew. As I said, it started in New Rochelle, and we really wore the brunt of it. Just like Brooklyn, where my daughter practices, really, really, they wore the brunt of it. Park Slope area and all of those, even the fancy areas, they did. The amount of deaths that we saw, the fact that we had freezer truck outside where the bodies were being placed, the fact that we lost our colleagues, uh, nurses, social workers, physicians, at that time no vaccine was available. So the conspiracy theories are especially against the vaccine, and a lot of them, it's very interesting. It has brought out, perhaps it was because we were locked up, I'm not quite sure, people who themselves eventually showed up and took the vaccine were trying to spread rumors, and I knew these people, saying that they are going to put a chip in you. You're going to have a chip in you. I mean, I was surprised. I mean, so they're going to start putting free chips in us, and you are going to be, they're going to be able to monitor you. They are going to be able to do this to you, do that to you. It was shocking. The big thing among our South Asian community has been, and that includes family members who have become convinced that if they give the vaccine, especially to the girls, their fertility is going to be completely rendered nil, and they are not going to be able to have children. And I've had conversations with them telling them that from the time, even before conception, the number of eggs that a young girl or baby girl or whatever you want to call it is going to have are there. There's nothing, I mean, short of radiating that baby or doing something else, the vaccine is not going to do anything. But this has become a big factor, particularly in South Asians, where they feel that they are going to interfere with their children's, rather, let's put it like this, that the children will be rendered unable to have children of their own.